Hello, my name is Rosalind May Domingo, and today I'll be presenting about foundational theory review and reflection. So this is our agenda for today. We'll be discussing five theories and how they could be interpreted in action and the organization where I work right now. So why use theories? We have different reasons why we should use theories, but mostly it's because they help create reliability of understanding when we're talking about public administration and related events in our organization because they can accurately describe, explain, and predict events depending on what we use, of course. So this is my organization, Cedar Sinai Medical Center, a brief history. So Cedar Sinai is the West Coast's largest nonprofit academic healthcare organization based in Los Angeles. It was built in 1902 by the Jewish community in response to the rising public health crisis of tuberculosis during that time. It was initially named Kaspar Khan Hospital, but later named Cedars of Lebanon. And then in 1918, another part of Cedar Sinai was created, which is actually a separate hospital then, a hospice, Mount Sinai Hospital, which was built in response to the influenza pandemic, and it became a hospital for the incurables. After a few decades, these two different hospitals actually merged in 1961 to form what we know right now as the Cedar Sinai Medical Center. And in 1994, it expanded its system and renamed it as Cedar Sinai Health System, which included different multiple affiliated hospitals, different community health centers, and then also affiliations to private practitioners, which are called Cedar Sinai's Health Associates. So we now go to our theories in action. So our first one is responsiveness theory. This theory mostly focuses on street level institutions such as police departments, schools, welfare agencies, and nonprofit agencies that directly serves citizens and their needs. It focuses on client responsiveness, satisfaction, need, performance measurement of professional or semi-professional workers. It emphasizes understanding and prioritizing the needs of the citizens or clients of the service delivery. For this one, it's healthcare delivery. So it's usually based on client feedback and expectations, and sometimes there are rules and exceptions just to cater to client expectations. So in Cedar Sinai, as we've mentioned, it's actually built to fill the gap in healthcare in early 1900s, and then as they grew, they provided more services throughout the years, which is a response to the community itself. And then that's how we can say it's client responsiveness. For anecdotal theory, sometimes there are some units like ICU units that actually breaks their own rules and regulations when there are clients that have families that are unable to visit them during regular hours. So sometimes the managers provide better client responsive service. They would allow them to come inside and outside usual hours just to make sure that the actual patients have support. The next one is systems theory, which focuses on how organization responds to and interact with its environment based on multidimensional and complex structure. It basically notes that it is a complex, dynamically intertwined and interconnected elements and it's adaptive in a cause and effect relationship because service delivery is based on optimal solution to changing circumstances. So in action, as we've mentioned, again, Cedar Sinai was established to fill in the gap for the demands for hospital services. And then later, as it grew, as with the science and technology and public health policy, it actually adapted into the system and it made sure that all parts of the organization are actually growing with the technology. And then just to make sure the institution has enough resources, it established system of donations and fundraising initiatives. And then it also merged with several hospitals to make sure that it's more accessible to different communities. And in response to bureaucratic policies, it actually followed and restructured the organization just to meet this. And then recently, due to the recent DEI executive orders, it actually renewed its commitment to its core values, and but it's still making sure that federal and state laws are always being followed within the organization. Next one is representative bureaucracy theory, which emphasizes a bureaucracy that reflects the diversity of the community it serves will more likely respond more efficiently to the interests of the group it represents. This basically says that even if it's not uh, an elected bureaucracy, if uh, the people in there are actually as diverse as the community it serves, whatever product or service delivery they have will be a positive thing for the community. So there are three parts: passive, active, and symbolic representation that are in here. So they are the different parts of representative bureaucracy theory. And then this translates into organizational structure, wherein both administration and medical staff are accepted and uh, solely on their credentials. This is one of the DEI efforts that actually being implemented. And then if there are any employees who are aiming for higher positions, or they are given resources, training, and accommodations to help support them in their journey, and even support groups for this. As client approach, so all patients, they make sure that there's no discrimination regardless of payer status, coverage, or ethnicity, and they make sure of this by providing different resources like language interpreters, translated documents. And then for the community itself, they provide community clinics, grants, health resources, and education, and volunteer programs for everyone. The fourth one is capture theory, which emphasizes the role of bureaucracy in changing, affecting, or influencing the regulating bodies that oversee it through different policy actors. So it's basically the regulated body is affecting the regulating body. So for Cedars-Sinai, it's under different healthcare regulating bodies, such as this one that you see. So even though we do have a lobbying body based in Washington, D.C., more of the influences that Sinai have is on the survey result appeals. So whenever we have regulatory surveys and we get the results, the Office of Licensure, Accreditation, and Regulation with the risk management will actually appeal any findings that they see that are wrong or unreasonable. And this is how we mostly affect the regulating bodies. And because of the commitment to social and healthcare equity, I believe that it is a positive response, really. The last one is transformational leadership theory, which assesses the influence of a leader in initiating organizational changes, including in structure, procedure, or culture. So this theory basically focuses on the part that effective leadership makes effective organization. So Cedars-Sinai President and CEO Emeritus Thomas Prisilak actually encouraged collaborative leadership across administrative and medical staff leadership. So even before he eventually retired, because of his commitment to collaborative leadership, there were a lot of oversight committees and other councils that were created to make sure that the different parts of the healthcare community, I mean, the healthcare organization, can self manage or self regulate themselves. And because of this, there are a lot of venues for transparency and accountability, and also for uh, leadership, staff engagement, such as regular town halls and annual engagement surveys. So, in conclusion, an organization is actually a complex organism affected by many internal and external factors. And by using theories to describe, explain, and predict the events or patterns of bureaucratic behavior, this helps in understanding how the public administration works within the organization within Cedar Sinai. And though here the theories used are not that exhaustive, there's only five of them. It helped identify how a 12-bed hospital in 1902 actually grew into a global high-ranking healthcare institution. And that's the end of my report. Thank you so much for listening, and I hope you learned a lot from this presentation. Thank you.